Thank you all very much for coming for a very, very important announcement. On January 8th, the Senate Health, Education, Labor, and Pensions Committee that I chair launched an investigation into the outrageously high price of inhalers that 25 million Americans with asthma and 16 million Americans with chronic obstructive pulmonary disease, COPD, rely on. And I want to thank Senators Baldwin, Lujan, Markey, Smith, and others on the committee for their work on this effort. Our investigation pointed out that in many cases, Americans were paying more than 10 times the price for their inhalers compared to the people of other major countries. 10 times more. The reason that we focused on this issue is that each and every year, some 3,500 Americans die from asthma. Most of these deaths are preventable with regular treatment and affordable care. Equally important, millions of people with asthma and COPD are paying far more for these products than they can afford. In some cases, thousands of dollars a year. As part of this investigation, we sent a letter to all 4 of the major manufacturers of these inhalers. And those companies are GlaxoSmithKline, AstraZeneca, Boehringer Ingelheim, and Teva, with one very simple request. Stop charging Americans with asthma and COPD, by far the highest prices in the world for inhalers. Very simple request. As a result of this investigation, our committee learned that GlaxoSmithKline charged $658 for Trelegy Ellipta in the United States, $658. But that exact same product could be purchased for just $59 in Germany, $57 in the UK, and $48 in France. AstraZeneca charged $645 for Breztri Asprophyr in the United States, but that exact same product could be purchased for just $95 in Canada, $80 in Germany, and $57 in the UK. Boehringer Ingelheim charged $527 for Spiriva Respirant in the United States. That same product could be purchased for just $54 in Germany, $29 in the UK, and $21 in France. Today, we are pleased to announce that less than 3 months after we launched our investigation, all 3 of these major corporations have made a commitment to cap the cost of all of their brand-named inhalers. Within a very short period of time, the vast majority of Americans with asthma and COPD will pay no more than $35 at the pharmacy counter for the inhalers that they purchase. This includes the uninsured, it includes the underinsured, and those who have commercial insurance. Repeat, people will not be paying more than $35 at the pharmacy counter. This does not cover people who are on Medicare and other public programs. Teva, the smallest of the 4 companies that manufacture inhalers, has not yet made that commitment. We hope that they will in the very near future. A Vermont resident recently told my office that she had to pay $320 per month for Boehringer Ingelheim's Spiriva HandiHaler. As a result of this decision, what we are announcing today, she could save more than $3,000 a year on the inhaler that she needs to breathe. Millions of others will enjoy similar benefits. During the last several months, I have had the opportunity to talk to the CEOs of Boehringer Ingelheim, GlaxoSmithKline, AstraZeneca, and Teva. And my impression is that these companies, as well as many others in the pharmaceutical industry, are beginning to catch on to the fact that the American people are sick and tired of paying astronomical prices for the prescription drugs they need to stay alive or to ease their suffering. Further, Americans, whether they are Democrats or Republicans, conservatives or progressives, cannot understand and will not continue to tolerate paying by far the highest prices in the world for prescription drugs. A major priority of the Senate Health Committee has been to lower the high cost of prescription drugs in our country. Working with the Biden administration, I'm proud of the progress we have made. Last year, the CEO of Moderna committed during a Health Committee hearing that his company would set up a patient assistance program so that no one in our country would have to pay for their vaccine out of pocket. In a separate Health Committee hearing last May, the CEO of Eli Lilly committed that his company would not raise prices on existing insulin products after announcing a very substantial price cut for these products. While the committee's efforts are beginning to pay off, obviously much more needs to be done. In his State of the Union address, President Biden discussed in a very significant way the need to lower prescription drug prices all across the board. It's not just asthma, it's not just COPD, it's not just diabetes. Today, individuals, hospitals, and insurance companies continue to pay unsustainably high prices for prescription drugs. This is one of the reasons why in America we pay by far the highest costs for health care compared to any other country on earth. This has got to end, and I look forward to working with my colleagues on the committee, with the President, and with all of Congress to make that happen. Senator Baldwin.
Thank you, Chairman Sanders, and good afternoon. I am excited to join all of you today to celebrate some progress, the progress that we have made to lower costs for families. Traveling the state of Wisconsin, I hear devastating stories from my constituents, many of whom are struggling to afford life-saving and necessary medications. I've talked to folks who ration their medications. I've talked to others who forego them entirely. And I have one constituent who talks about keeping her heat down all winter long in order to be able to afford her prescription drugs. Just this week, when I was home, I was talking to a woman named Vicki in Milwaukee who has COPD. Vicki told me that every day she wakes up, she decides whether she's going to use her inhaler that day, or maybe she can make it another day without using the medication that she needs to breathe. Even with Medicare, Vicki told me she pays about $180 a month for her inhaler, plus an additional $40 a month for a rescue inhaler. And many people with COPD have to have both. That's a total of $220 a month just to breathe. And Vicki isn't alone. 25 million Americans, including more than 500,000 Wisconsinites, have asthma, and another 16 million have COPD. The prices that many of these Americans pay is beyond the pale. Plain and simple, these Americans, our friends, our neighbors, our colleagues, our loved ones, are being ripped off. The big drug companies that manufacture inhalers are raking in billions of dollars in revenue. Their executives are getting paid millions of dollars. All the while, they charge Americans 4, 5, 6 times as much as people in other countries. And we found that some Americans are paying as much as $650 for an inhaler, where people in other countries are paying $50 for the exact same inhaler. That's 13 times as high. 13 times. Not only that, but many are rigging the rules to box out our competitors, their competitors. So we launched an investigation into these companies. We reached out to these drug companies to get some answers as to why Americans were being price gouged. And now, less than 3 months later, 3 of the 4 companies we looked into capped out-of-pocket costs for many of their products at $35 per month. These three companies represent 75% of the inhaler market. This is the power of transparency. For Wisconsinites like Vicki, a $35 a month cap on the cost of inhalers will save hundreds of dollars. But more than that, it means that she can breathe easy, knowing that the medication that she needs to stay alive will not be out of reach. I'm proud to have taken on these big drug companies and lowered costs for middle-class families, and I know we have more work to do to give relief to Wisconsin families and families across America. But this is a great start. Thank you, and I now want to turn the podium over to my colleague, Ben-Ray Lujan.
Well, good afternoon, everyone. It's good to see you all here. I want to especially thank Chair Sanders as well. Bernie, thank you for the work that you have done in this space with your staff. This is really a team effort. And the members that you see here collectively used our voices, raised our voices to amplify stories like the one that Senator Baldwin shared with you, to stand up for what's right. In the face of people getting pushed around or trying to figure things out, we all need to speak up. And this is really a tribute to every one of the journalists across the country who told stories, who listened to patients and constituents, and raised those voices up to create a moment where we are empowered to act even more. So please continue to do that. The investigation from the HELP Committee brought to light how folks were paying up to 70 times more than counterparts in different parts of the country for oftentimes a piece of plastic that holds important medication, as Senator Baldwin said, allows you to just breathe. I hope that sinks in a little bit. It's just unacceptable. The treatment that regular, everyday Americans get from so many of these folks that are putting more and more money in their personal pockets at the risk of someone dying. And before we started today, a few of us were chatting about the spring and how we're all welcoming the spring in. Well, with it comes allergies. And those of us prone to asthma, when a little bit gets off kilter, then the threat grows exponentially. What happens if you can't afford that inhaler? Thanks to this effort, as you heard Senator Sanders, Chair Sanders say, $35 is something that's more affordable. It can still be out of reach to too many, though. So our work continues. But this is something that we all should recognize. Families suffering with COPD, if you may be one of them, or you know someone, you know what happens when that moment strikes, where you're not certain if you can inhale or exhale. What does that do to the rest of the trauma in your body, and what does that amplify within every one of these conditions as well? It's endless. So again, to my colleagues that I have the honor of standing with today and every day, I want to say thank you for standing strong, moving together, and being able to turn the ship a little bit. It's just a start, and we will do more, but I want to commend everyone that was a part of this. Thank you so very much. And with that, I want to recognize my colleague and my friend, Senator from Massachusetts, Ed Markey.
Oh, thank you.
Thank you, Ben Ray, and thank you, Chairman Sanders, and thank you to my colleagues, Senator Baldwin and Senator Lujan and Senator Smith. In just 3 months since the start of this investigation, 3 companies, AstraZeneca, GlaxoSmithKline, and BI, are capping the out-of-pocket costs of all of their inhalers. Every single one of their inhalers will now have a cap on it. And this investigation brought down the prices of inhalers for 75% of the inhaler market. And that's a big drop. $658 to $35. $645 $35. $527 down to $35. $286 down to $35. Think about that. Your home, can we afford it? Can we just make it through a few more days maybe? But now, at $35, it's just a completely all new ball game for people at home in terms of their access to inhalers. And that is essential for the 31 million Americans living with asthma and COPD, because those are chronic lung diseases. And capping those prices will literally help millions of Americans breathe easier, especially environmental justice communities, so often living with lower air quality and higher rates of respiratory diseases. We know why Black and brown communities were most impacted by COVID, because there was already a pre-existing higher rate of asthma in those communities that made them more vulnerable. That's where inhalers are going to come in very, very handy in helping them to protect their family members. But what about these three companies? Why has it been so overdue as a step forward? Well, unfortunately, these companies wouldn't have made this change if there wasn't a problem to begin with. That's what Senator Sanders and the rest of us have tried to deal with. For years, these companies let people struggle to breathe as they inhaled billions in profit. For example, Teva, who still has not committed to a price cap, made a $1.7 billion revenue from 2018 to 2022, while they charge Americans $286 for inhalers that are priced at $9 in Germany. GlaxoSmithKline CEO makes $15 million, while they charged Americans $319 million for an inhaler that is priced at just $22 in the United Kingdom. AstraZeneca's CEO made $20 million, while the company charged Americans $432 for an inhaler that is priced at just $42 in Japan. They overcharged Americans. They choked out competition by gaming the system. They charged high prices in the United States for inhalers that sold at a fraction of a price abroad. And those prices hit Black and brown and immigrant and low-income and working-class communities breathing in dirty air the hardest in our country. That's a horrifying cycle. Air pollution leads to higher asthma rates, which means people in frontline communities are more likely to be footing the overinflated bill for their inhalers. They need inhalers more than other parts of the population, and they had to pay those extortionary prices. It is a breath of fresh air that some of these companies are taking steps in the right direction, but there is more to be done. Teva must follow AstraZeneca, GlaxoSmithKline, and BI and cap inhaler prices. Pharmaceutical companies must truly tackle the climate crisis by ensuring affordable medications and not polluting our planet. And we must guarantee that no American has to choose between paying their bills and taking medications that are as essential as the air which we breathe. So we thank you, Chairman Sanders. I congratulate my colleagues as well. And back to you.
Senator Smith.
Thank you very much. It's great to be with all of you. So I want to thank Chair Sanders and my colleagues standing here to be clearly on the side of everyday Americans fighting against these big drug companies who have been raking in the profits while people are struggling to pay the very medications that they need to stay alive or to be healthy. This has the pressure that Chair Sanders and Democrats have brought to bear on these big companies has resulted in a significant reduction in prices for inhalers for Americans. And this, I can tell you, is a huge deal for Minnesotans who will now be able to get the inhalers that they need for $35, no matter what kind of insurance they have, or even if they don't have any insurance at all. So just think about the impact of that just for people that are suffering from asthma. In Minnesota, that's 428,000 people who live with asthma, and almost half of them are not completely managing their condition. Okay, so why is that happening? Well, it's because patients can't afford these inhalers. And when you understand that Americans are paying 10 to up to 70 times more for the exact same inhaler that people are getting in other parts of the country for far, far less, you understand the scope of the problem that we have here. The reality is that for years, these manufacturers, these big pharma companies have increased their prices for American patients, and meanwhile, Americans are truly paying the price. And here's the thing. I mean, just like other conditions that we see in this country, Black and Native and Hispanic and Latino Minnesotans are far more likely to have asthma than white Minnesotans. So I am grateful to the work of Chair Sanders and the HELP Committee and staff for this investigation, really shining a light on the price of inhalers. It is fantastic to see 3 of the 4 major manufacturers have agreed to a cap on patient copays of $35 for all patients. And this, as you've heard, represents 75% of the market. So it is a big deal. We also know, of course, we have more work to do to control the outrageous prices that Americans pay for prescription drugs. And all of us up here will keep on fighting to lower prices for Americans. Because really, unless you're the CEO of a big pharma company, how could you be opposed to that? Thank you.
Thanks very much. Thanks to all my colleagues. Any questions?
When the insulin manufacturers reduced their prices, there was a general consensus that it was the Medicaid rebate change that kind of drove that. Have you and your staff determined if that or something
No, we
similar?
do not think that's the case. In this instance, we think it's public pressure. We think it's the understanding that these companies are beginning to learn that the American people are sick and tired of getting ripped off. So I think what we're talking about is it is indefensible. Very hard to come before Congress or the American people and explain why you're charging 10 times more for the same exact product. I think that's the basic reason. Yes, ma'am.
Do you think it's also, now that these companies are capping the price to $35, do they still have to delist the patents from the Orange Book?
The FTC separately is working on that very important issue, and they have worked separately from us, but I want to congratulate the FTC and Lena Khan for the work that they are doing. Yes, sir.
Dan Diamond, Washington Post. 2 questions. First, what has Teva told you about why it is not capping prices?
I just talked to them the other day. They are considering it. They are a different type of company. They're primarily a generic company. They're much smaller. My hope is that they will end up following suit.
And second, Senator, you and others have said that this is the start of your efforts. What other...
Well, not quite the start. We have done some other work as well, but we're going.
Which we've reported on.
Yeah.
But are there other devices or treatments that you are targeting next?
The target is very, very broad. You cannot but open your eyes and see outrageous price discrepancies in terms of what the American people are paying compared to other countries. So we are going to continue. Trust me, we will. The committee has to decide where we go next. But for the pharmaceutical industry, let me make it very clear. The American people will not continue to pay the highest prices in the world for prescription drugs. You've heard from my colleagues the choices that working people have to make, whether they heat their homes, whether they buy their food or they buy their drugs. That has got to end, and we intend to play an active role in ending that. Yeah.
So only some of the list prices have been dropped on these inhalers too? Have you had discussions with the companies about that, not just the copay cap?
Some of the list prices have gone down. But for us right now, the major concern that we have is that when somebody walks into a drugstore, they're not going to be paying more than $35. But then you're touching on the complexity and the lack of transparency. You're talking about the role of PBMs and everything else. That is an issue the committee has also worked on and will continue to work on.
What have the companies told you in relation to the list prices in your...
Some of them will drop their list prices. Yeah.
Are you thinking about, like, patents are another way of these prices to
Yes.
like, high? So
Look, there's no debate. I think everybody understands that these large companies have manipulated the patent system. They come up with a tiny tweak, and then they want a significant extension of their intellectual property. That's just one more way that they're ripping off the system. So yes, that is an issue we've got to look at. All right? Okay, thank you all very much.
Thank you.